Is far-UVC light a safe solution for TB prevention? Imagine a technology that could help reduce the spread of tuberculosis without harming people. Far-UVC light, especially in the 207 to 222 nanometer range, is showing promise as a safe and effective way to do just that. Unlike traditional ultraviolet light, which can cause skin burns or eye damage, far-UVC cannot penetrate the outer layers of human skin or the tear film of the eye. This means it can inactivate airborne bacteria and viruses without risking harm to people nearby. The way far-UVC works is by damaging the DNA or RNA of microorganisms in the air. Since tuberculosis, bacteria are spread through tiny airborne droplets. Inactivating these bacteria in shared indoor spaces could significantly lower transmission risk. Laboratory studies have shown that far-UVC can kill over 95% of airborne viruses and bacteria, including some drug-resistant strains. While specific studies on tuberculosis bacteria are still limited, the broad antimicrobial effects of far-UVC suggest it would be effective against Mycobacterium tuberculosis as well. Safety is a key advantage of far-UVC. Because it cannot penetrate beyond the dead outer layer of skin or the outer tear layer of the eye, it does not pose the same risks as conventional germicidal ultraviolet light, which can cause skin cancer or cataracts with prolonged exposure. Properly designed far-UVC devices include filters to block longer wavelengths and are operated within safety limits established by health authorities. When used correctly, these systems can be installed in places like hospitals, clinics, and public spaces to provide continuous air disinfection. In terms of practical use, far-UVC lamps could be integrated into indoor environments where TB transmission risk is high. They offer a way to supplement existing measures such as ventilation, masks, and vaccination. Far-UVC is not meant to replace medical treatments or vaccines but can serve as an additional layer of protection by reducing the number of airborne bacteria in shared spaces. Current scientific evidence supports the idea that far-UVC light is both safe and effective when used properly. Ongoing research continues to explore its long-term safety and best practices for deployment. It's important to remember that individual health conditions vary, and people should always consult healthcare professionals for personalized advice. Overall, far-UVC light could become a valuable tool in public health efforts to control TB and other airborne diseases, especially in crowded or high-risk environments.